Hey guys, today we're going to do a comparison between um, medicine and public health, and then we're also going to look at some of the top accomplishments of public health. When we look at what medicines do versus what public health does, we see that medicine saves one life at a time, improves the quality of life of one person at a time, versus public health, which is potentially saving millions of people at a time. I think that's very evident today. If we had a medicine, we could save maybe one person or one person that's taking the medicine, where the efforts of the public health departments now are saving millions of Americans and just people across the globe. Public health deals with and touches every single person every single day. Okay. Um, if we are looking at some causes of death as well as emergencies, if we're just looking at one person, it's going to take us forever. Okay. So when we're looking at causes of death, we're looking at the cause of death in many, many people. Um, that's how we get changes. That's how we um, work to save millions of people. Um, Whenever we're looking at something that's being done, an agency or some goals, we look at, are they being successful? Okay. I think we can look at public health and see that they've had some success. Okay. If you look at this chart in the 1900s, the life expectancy was about 47 years old. Okay. Um, as I'm aging, um, thinking that maybe I only had 9.5 more years in my life is frightening. Okay. At most. Okay. Um, Back in the 1900s, you lived to be 50 years old. You had lived a very, very long life. Okay. Um, which is why um, the trends, they got married much younger. They had children much younger. Okay. There are some people that are still, um, have very, very young kids at 47 years old. Okay. Or maybe are just starting their families. This is an old PowerPoint, so it shows back to 1996. Okay, in 1996, the life expectancy was about 78, 78.1. Um, just for a little bit of clarity, I researched and found that in 2017, so that's still 3 years old, the life expectancy hadn't jumped much. It had only gone up to 78 and a half years old. Okay. So the biggest jump was, from the 1900 to 1996. Okay. When we're looking at that time period, it's gone up about 30 years. And we can attribute about 25 of those years to changes in public health. What are some of those changes? We could probably easily rattle off a bunch of those changes. Okay. Vaccinations. Okay. That's an easy one, especially with everything that's going on in the world today. Um, I can't tell you the number of times I've heard people say, well, they're working on a vaccine. They're working on a vaccine. We're a year out from a vaccine. It's scary that we're still so far from a vaccine. Okay. Um, there are much, much fewer cases of measles and polio and smallpox. All of those things due to vaccinations, okay? We had, in 1900, there were tons and tons of deaths attributed to all those things, okay? That's why we have all these vaccinations. Um, right now, I've seen lots of Facebook posts or memes or whatever about those people who fight vaccinations and say, that it's my right to not have my child vaccinated. Okay. And then on the flip side, you look at all the panic and all the sickness and everything else that's going on right now because there isn't a vaccine for COVID. Okay. Um, I think it makes a pretty good case for the importance of vaccinations. Okay. Safer workplace. Of course, in that time frame, we've had OSHA getting involved, making regulations to keep workplaces safe, safer and healthier food. Okay. We know now that meats have to be cooked at a certain temperature, things like that. Okay. Motor vehicle safety. Back in the even in the late 70s, early 80s, um, there weren't the car seats, okay? All those kinds of things. It's second nature to you and I that a kid needs to be in a car seat, but it wasn't always the case. I remember as a small child not often not riding in a car seat or buckled up even, okay? Um, control of infectious disease. Um, that has been due to vaccinations, increased sanitation, the use of antibacterial soaps. All those things have controlled infectious disease. Decline in the death of from coronary heart disease and stroke. There's a lot of education that's gone on in this time, knowing that smoking is bad. Smoking can be very detrimental to our health. Um, having blood pressure meds, okay, meds that control blood pressure obviously decrease on heart disease and stroke. Just the simple fact that we now know that tobacco is bad, that has led to an increased life expectancy. Okay. Healthier mothers and babies. Obviously, like everything else, we've improved on nutrition for both mothers and babies, on medicine, neonatal care, the immunizations, again, improve the health of babies. Okay. Um, I want you to look at this list, and one of your assignments for today is to pick out and discuss what public health achievement do you think has been the greatest and the biggest contributor um, into our increased life expectancy. Okay. That's all for tonight. And we will discuss a little bit about these achievements in a later assignment today.